you've seen quite a lot of things change in a fast-moving field. And so, I mean, would you say this is an exciting time to be a geneticist?
When I started, until now, the changes have been extremely dramatic. And the abilities of genetics to have an impact on almost any aspect of life has, I think, revolutionized many parts of society, and not least also healthcare, although there's a lot of potential that needs to still be fulfilled in terms of realizing the insights that have been gained and put them into practice. There's still a long way to go there, I think.
Very specifically about this meeting, it's the first time bringing together the Biobank and the research communities. Do you think that's a good idea? Has it been successful at this meeting?
I think it's a start. My experience, I think, is that the genetics is moving faster than the biobanking, if you will. And there are many reasons for that, of course. But if this meeting could be an instigator to faster movements and development collaboration to realize the potential that is definitely there, that would, in all contexts, be extremely beneficial for the patients eventually. So I hope that this will, speed up developments.
If genetics is moving faster at the moment than biobanking, which aspects of biobanking can or should be moved faster?
Well, it's not necessarily that the biobanking field is moving slowly, but it's the conditions surrounding both biobanking and healthcare and all of these things are not instigating rapid change, right? It's rather the opposite. And the legal situation is very difficult in many contexts. Both the European, the Norwegian laws and their interpretation in the various substructures within the country, within the hospitals, within each department of the hospital almost. There are so many understandings of how and what you can do and how you can do it, and how to apply to access and all of these things. That makes it extremely hard. And in most cases, it ends up with a scientist being responsible for everything and liable for everything. And, you're sort of working in a minefield all the time. But then again, if you look at it, how many times have you had, big breaches from ongoing research? Not a lot, right?
Right.
So I think that something has to give here in the form of laws and regulations in order for, to make things interchangeable in a completely different way from what is the case now.
So do you think that people in the Nordics, maybe Norway specifically, have that same fear that, say, Americans have, because they fear that if the insurance companies get a hold of their genomes, then they'll drop people who they think are going to develop expensive diseases? Do you think that same worry or fear of data insecurity exists in the Nordics? I
think it's more a matter of the fact that the society on this side of the ocean is more, it's more trusted. There's more trust, and I think that is a good thing. And but of course, it's also a matter of the research is publicly organized, while a lot of the companies are obviously in it for the money, and there is a discrepancy that is felt also by the public, I think, in Norway, so that there is much larger trust in the public sector than in the private sector. In areas like cancer, where things are life-threatening, or in childhood diseases, it seems like there's more trust in using genetics, or I think these areas. So maybe I could
transition toward cancer, which is the field that you've worked in for so long, and just ask this, where is cancer precision medicine relative to all the other common and the complex disorders?
I think it's fair to say that it's in the forefront, and it has been so for a long time. Of course, the cancer is to a large degree a somatic disease. The bodily cells are affected, not the germline in the same sense. Well, of course, there is also germline, but you can do a lot with the somatic cells. And cancer is so many diseases and entities. And but I think it's fair to say that because of this complexity, cancer has also been in the forefront of technological exploration, if you will. And to me, that has been very fruitful. And I think there's a much deeper understanding of both the cancer in general and the different specific cancer diseases specifically, and not least the underlying biology. A lot of the cellular biology in cancer or developments and understanding of the cellular biology, molecular signaling, has been driven by cancer. So, because of course there you have a lot of failings in the cellular signaling, and therefore it's very nice to understand what the failures are in order to understand the normal function, right? So, yeah.
Can you say a little bit about the work that you do that has to do with European or global initiatives?
Yeah, to start out with the Nordic situation, I've been involved for 3 funding cycles of funding from the Nordic Council of Ministers through what is called the Nordic E-Infrastructure Collaboration, which has been extremely fruitful on trying to develop secure mechanisms for handling of sensitive human data, meaning, the genes of the patients. And different types of solutions and common technology has been developed through these projects over a period of almost 10 years. And this has actually put the Nordic countries in the forefront, also in a European setting, on this matter. And this is highly relevant in these times, because there is a plan to create a European health data space. There's a regulation that has been agreed upon, as I understand it, in the European Council, but it's not yet a reality, but it's coming. And there is initial activity to do piloting for that in various contexts. And one of these pilots is what is called the 1+ million genomes project, which is to share genomes across Europe for 1 million people or more, along with their some information about the patients, or if there are patients, or if they are normals, which country they come from, or what diseases they have, and other things about them.
Just to jump in and interrupt, I mean, I've heard that a criticism is that the phenotypic data is so sparse in places other than the Nordics. What's the point of the Nordics joining in these efforts?
So this is, as I said, also to create a reference, a European reference, and there is also then the half of it is supposed to be normal individuals representing each population or country in Europe, in order to have that as a reference for finding out if something is potentially a disease entity that you're looking at, or a normal variation. But there is also then a set of diseases that are of relevance, being cancer, infectious diseases, complex diseases, and rare diseases. And these, you will have certain sets of data that are relevant. And in order to utilize the information contained in these larger efforts, you need to have a platform to share these sensitive data. And so technology is being developed at this time to try to realize that along many axes. And also, there are a number of standards being developed for having the ability to, share quickly and get access to the data. In order also to realize the potential of, for instance, these things like artificial intelligence and so forth. But on the other hand, you also need to have the regulations and laws quickly being, that you can actually realize it in your lifetime, getting access to data and so forth. And that's currently still a huge barrier. So I see that something has to change, and the hope is that the European Health Data Space, in fact, will provide some of the easing of the current barriers for sharing.
And how would it do that? Would it be establishing some basic set of guidelines or structures for security?
So it remains to be seen exactly how this will shape up. But my understanding is that you will have access both from the patient side, from the researcher side, from the primary physician side, and the specialized hospital functions. All of them will have access to sort of the same set of data eventually. And if that were to be the case, then you would have a common platform from which to do sensible research. And I would say that having a real-time, if you will, real-world platform of being able to query all the relevant data being generated over time as it happens, I think, that is the grail you try to strive for.
Are you on the board, or do you work with the European Health Data Space?
No, what I am doing is I'm part of the projects that try to drive in that direction. So I've been participating in, for instance, pilot activity to sharing cancer data across countries to realize one simple research question on these data that is very possible if we were able to share the data, but we have now been working for 2 years without being able to share data for patients that have actually consented to sharing the data. But the consent was phrased not specifically for the purpose of what we're doing. Therefore, we are required to reconsent the same patients, and if they are dead, we are required to reconsent the closest relative of those patients that have died. And they don't even necessarily need to be related to the patient, right? And it's simply unfeasible. And if this is the situation 2 years from now, nothing is going to happen.
Anything particularly interesting that struck you at this meeting?
Well, I think to me it's been sort of an incremental development where there was a meeting in this Nordic society a couple of years ago, and there were some biobanking contacts at that time, and I think it has matured over time. So it's an incremental development where they see that they need to get together in order to realize the potential of the biobanks. I would say that it's getting late in the day because we could have done this earlier if we had the legal framework and also some technical framework to actually achieve the potential.
So 2 years from now in Copenhagen, what would you like to see? Not necessarily what would you like to have seen change in 2 years. I mean, that's one question, I guess. But I'm thinking more of who's not here, or what kinds of workshops or symposia are not here that you think could be there in 2 years.
Well, so there is one poster here, which is about Nord3, which is the Norwegian trusted research environments coming together to create a joint structure in order to be able to do computing on these larger scale data efficiently. Currently, we don't have anything like that really in a Nordic setting or in a European setting, where I mentioned that the European Health Database could be an actor. But if we could have some sort of tangible, basis on which to actually do computing and, share data in a sensible way, in formats that are sensible and exchange procedures and all of that, then that would be great. And then that biobanking community could also sort of tag along on that on a common platform to a larger extent than is the case today, to come up with something that I would like to see happen anyway, right?
Yeah. Going back to computing, is there... It seems in some of the meetings that I've been in that have more to do with data and informatics, that there is an inherent lack of not tension, but just the computing community and the research community are not necessarily always working together hand in hand. I've heard that in some of these sort of meetings, and maybe they were in fact Nike meetings where the researchers said, well, we would like to have more input, and the supercomputer gurus or those folks say, well, we need more input from the researchers. It sort of seems like a problem that's just,
I'd like to add one dimension, and that is that you have the researchers and you have the computing guys, but you also have the hospital structures. Because we're talking about data originally coming out from a lot of hospitals to a large extent, right? And the problem is that the hospital IT is substandard, if I could put it mildly, in the context of genomics or in the context of sharing data, in having them standardized across. I mean, even the Norway, being a small country, has 2 different electronic health journal systems, which is, I'm not going to characterize it, more than saying that I don't think it's very smart. And none of it is really well standardized and mapped towards international open standards, which they should be. The problem is that for that to happen, you need to have systemic efforts from the hospital's side to be able to do that, because the mapping actually, lies with the responsibility of each hospital, but they're not geared for sharing of data. They're geared for, helping patients, right? So that's a challenge in and of itself. And I think on top of that, you don't have a common platform for where to put the data or where to compute. There is a development coming in Norway, potentially, of the Genome Center, the Norwegian Genome Center, but that's still vaporware, if you will, from the perspective that is being planned. We don't know in which way it will, potentially mutate to provide something or some functionality that is useful, or because we also have some bad memories from the health analysis platform that was a complete failure, because it was also led not from competence, if you ask me. It was led by the consultancy companies wanting to make a buck. And that's my take on it. I may be misinformed, but at least it never came to fruition, right?
You've made, I think, plenty of bold statements, but the wrapping up question is, do you have a bold statement or maybe a prediction about something important, controversial about your work or the future of healthcare that you...
So there was a discussion earlier in this meeting that the hope was that Europe would be a driver to change things here in the Nordics from a legal perspective and from a collaborative perspective, and that could be a hope because of the European Health Database, as I discussed. something has to give in the form of data sharing and infrastructure in order to really be able to harvest the potential of precision medicine that is definitely there, but which is what I've been working for all my life scientifically. And I have a hope that that can still happen before I die. But then that, the basic rules have to change somewhat in order to enable researchers to another extent than is the current situation.
Okay. Well, thank you for taking the time. Appreciate it.
Yeah. Pleasure to come with some rants, and hope that somebody with power could listen randomly in.
Yeah, maybe we can, re-rant in 2026 in Copenhagen.